The state of our health, something we strive to improve and maintain, but sometimes inadvertently destroy. Universally, it's vitally important. The Germans have a universal word for it. Gesundheit.
In today's edition, the future has arrived at a hospital in Mexico City where surgeons have teamed up with Zeus, a surgical robot, to remove abdominal tumours with minimal invasion and exceptional precision. Russian President Vladimir Putin has called on his countrymen and women to take up sport and cast off the nation's image as unhealthy drunkards who are dying well before their time. 35 years ago, in a quiet suburb of London, the modern hospice movement was born. St Christopher's Hospice is still at the centre of the movement, setting the pace in research into pain and innovative ways of helping the terminally ill and the bereaved. And a recent study conducted on 2,000 women showed that those over 24 with no history of heart problems were at a slightly higher risk of having a heart attack if they were on oral contraceptives. But first, imagine preparing a crack pipe as part of a new addiction therapy program. The drugs are fake, but the cravings are real. This is ERP, Exposure Response Prevention, a rather unconventional therapy. 38-year-old alcoholic Elle begins her session with relaxation exercises. Then she repeats personalized mantras called cognitive scripts, which drum in the many reasons to quit.
If I continue to use, I will die.
If I continue to use, I will die.
Then it's the hard part. She's confronted with the drug which ruined her life. ERP flies in the face of conventional therapy, but according to these addicts, the only way to beat their drug demon is to literally face it head on. Counseling isn't always enough for alcoholics, and some need medication too. A new study has called into question whether the popular drug naltrexone, often prescribed to recovering alcoholics to suppress their cravings, really works. Research in the New England Journal of Medicine found that older men who drank heavily for over 20 years often didn't respond to the drug. All volunteers in the study, whether they received the drug or a placebo, underwent individual counseling and were encouraged to attend Alcoholics Anonymous, a key component in treatment. The National Institutes of Health is funding several additional studies on new medications, most of which target specific areas of the brain that respond to alcohol. And speaking of drugs, a new study concluded that a popular vitamin supplement can actually be bad for you. The American Medical Association has indicated that too much vitamin A could double older women's chance of hip fractures. Most damaging was vitamin A found as retinol in vitamin supplements, fortified cereal, liver, and fish oils. Vitamin A in the beta-carotene form of leafy green vegetables had no link. Researchers found that postmenopausal women with the highest total intake of retinol had double the risk of hip fractures than women with the lowest intake. Doctors aren't sure why, but some think that too much retinol vitamin A either inhibits the body's calcium absorption or affects bone cell production. Doctors advise patients to continue taking multivitamins as they can prevent other diseases. Patients should also choose beta-carotene sources of vitamin A or limit their retinol sources to 500 micrograms a day. Speaking at a news conference in Berlin, German and American lawyers announced their plans to bring forward an amended class action against Bayer Pharmaceuticals in the United States. Bayer's cholesterol-reducing medication Lipobay has allegedly led to the deaths of at least 50 people worldwide and to health defects in at least 2,000 patients. The lawyer representing the German victims, Michael Witte, told journalists that the lawsuit will be presented to a court in Minneapolis. Witte stated it was important to provide both German and international victims of the biomedication with an equal chance of being compensated under American law. Just recently, Bayer had to take Lipobay off the market due to unsolved deaths allegedly caused by it. The US lawyer Kenneth Moll, working with Witte on the case, stated that Lipobay had been developed and tested by the US Bayer branch of the Bayer Corporation, and accordingly, the case should be tried in the US. Currently, more than 50 deaths worldwide seem to be connected with Lipobay, despite Bayer's claims that a connection cannot be proven. The lawsuit will not only be directed against Bayer AG and Bayer Corporation, but also against Europe's biggest pharmaceutical company, GlaxoSmithKline. SmithKline Beecham has been accused of having participated in the sale and marketing of Lipobay in the US throughout the past decade. Tula Westlake is having the time of her life on a 5-star vacation viewing animals in the African bush. But her trip is more than just relaxation. She's one of the growing number of scalpel safari tourists coming to South Africa for a nip and tuck, and then recuperating while on safari. A few days earlier, she went under the knife in a Johannesburg clinic. During 5 hours of surgery, she had a breast lift and enlargement, plus a tummy tuck and liposuction. Tula was thrilled with the results and felt she got value for money. Patients first relax at luxurious hotels before entering hospital for their cosmetic surgery. During this procedure, an inch of skin was removed from either side of the face and the muscles were pulled back.
It's not going to be painful.
The patient recovers in hospital before the safari begins. The mix of adventure and cosmetic enhancement is bringing much needed revenue to the beleaguered South African economy. And the future has arrived for those who can afford it at a Mexico City hospital, where Zeus, a surgical robot, can remove abdominal tumors with surgeons operating at long distance and with minimum invasion. Zeus became operable in Mexico City last September and is the same robot used in the first ever long-distance surgery in which a doctor in New York removed the spleen of a patient in Strasbourg, France, some 6,000 miles away. Zeus and 3 other new devices make up a family of robots used in minimally invasive surgeries. With high-precision instruments, doctors work through 5 to 10 millimeter incisions instead of fully exposed abdomens. Popular wisdom advises against starting anything at midpoint, but surgery starting at the navel makes it easier to introduce a camera to the abdomen. The technique has been refined to the point of having this procedure performed as routine. Sitting at a chair in front of the controls, surgeons maneuver the robotic arms to remove damaged tissue, suture the cut and return the stomach to its proper position. Stitches and sutures are cut with electricity to avoid any internal bleeding, and the whole procedure can be watched on several monitors. Surgery concludes successfully, while 30 similar procedures are pending approval all around the world. And our surgical rounds end today with a tall order from a short woman. We're at the Sinai Hospital in Baltimore, Maryland, where internationally known surgeons Dr. Paley and Dr. Hetzenberg will perform a limb-lengthening procedure on 20-year-old Meredith Jones. Meredith suffers from achondroplasia, or dwarfism, and stands 127 centimetres tall, but over the next 3 years she hopes to grow 25.4 centimetres taller. During the procedure, Paley will place 3 screws into Jones's humerus bone. To aid in the procedure, doctors will rely on imaging technology to show them the exact placement of the screw. Together, the surgeons have performed more than 4,000 of these operations and can complete their work on a limb in less than an hour. Dr. Paley carefully breaks Meredith's bones and locks them into place with an external fixture. For the next 7 months, she'll rotate the screw 4 times daily to lengthen her bones. The device works by gradually pulling the broken bone apart, which will then be filled in by new bone.
It's done 4 times a day.
The stark contrast between these two young women, a former patient who's completed the 3-year limb lengthening process and another patient just beginning the procedure, shows the dramatic results of this cutting-edge surgery.
Eliza, you know what time it is?
Russia's President Vladimir Putin is on a health drive. He wants his countrymen to get fit, stay off drink and live longer. The leader's recent statement was aimed at drinkers and smokers in Russia, where it's not unusual to see people of all ages smoking and drinking beer, sometimes in the morning on their way to work. Putin, the first Kremlin leader who is known to despise alcohol and cigarettes, told a meeting of the country's state council recently that the state of the nation's health was shameful. The Russian president, a black belt in judo and a keen skier, has called on political figures to take the lead in promoting a healthier lifestyle for all Russians. Some politicians have been quick to respond to the president's call. Russian Deputy Premier Valentina Matvienko and ultra-nationalist politician Vladimir Zhirinovsky recently took part in a cross-country skiing competition with their leader. The core of the problem is that sports in Russia have all but fallen off the political radar screen since the breakup of the Soviet Union. Latest statistics must make for unhappy reading back at the Kremlin. Only 10% of Russia's 150 million people take part in sports. Average life expectancy is 59 for men and 72 for women, but Russian women don't live longer because they're fitter. It's just that alcohol kills the men first. It's a rich irony that today's Russia boasts world-class athletes, including many professionals scattered all over the world. But this elite band of sports professionals has no grassroots in Russian society itself. Over the past decade, the country's sports facilities have been neglected and are crumbling due to the lack of funding, a far cry from Mother Russia's former glory. Today, a small but growing middle class is pumping iron. They clearly think that a fitness club membership is money well spent. At this expensive Moscow health club, members believe they're adding at least an extra 5 to 10 years to their lives. The problem is, health clubs with state-of-the-art facilities are priced well above the means of ordinary Russians, and affordable sports facilities are almost non-existent in small Russian cities. At one of Moscow's few junior gymnastics schools, 8 to 10-year-old girls twirl batons and do stretching exercise. It's a Soviet-era sports facility, but the best that the parents of these children can afford. Putin has called on Russian businesses to help fund cheaper and more widely accessible sporting facilities. The nation's health has now become a matter of public policy. Whether Putin will win the contest to stop the rot still remains to be seen. But with state funding all but dried up, many locals don't believe that businesses alone could do enough. As the Russians have discovered, where you live could have a profound impact on your health. The New England Medical Journal found that study participants who developed cardiovascular disease were more likely to live in disadvantaged neighborhoods. Whites living in such neighborhoods were found to have a 70 to 90% higher risk of coronary disease, while blacks had a 30 to 50% greater risk. Factors that contribute to illness include the lack of public spaces and recreational facilities, increased tobacco advertising, and the unavailability of healthy foods. Researchers also believe that exposure to noise, violence and poverty can contribute as well. Modern hospices offer people with incurable diseases professional medical help to control pain and, just as importantly, emotional support for themselves and their loved ones. But it wasn't always like this. In the 1940s, patients and their families were often distressed by a hospital system which wasn't set up to care for the terminally ill. Working as a nurse back then, Dame Cicely Saunders found little help available for patients with terminal illness. She decided to devote her life to improving care for the dying. She even trained as a doctor, researching new ways to control pain. In 1967, Dame Cicely founded St Christopher's Hospice in South London. It was the world's first teaching hospice, combining clinical care with teaching and research, as it still does today. St Christopher's cares for over 1,600 patients a year. Some are admitted to the 50-bed inpatient unit, but most are cared for at home by the doctors, nurses and social workers of the hospice's home care teams, an innovation pioneered by this hospice. Since its foundation, St Christopher's has been at the forefront of research for the care of the dying, which has now developed into a recognised medical specialty: palliative medicine. The regular and safe giving of oral morphine to control pain was first done at this hospice. 1 day a week, inpatients and those cared for at home are offered activities at the day centre, including craft work, aromatherapy, painting and creative writing. The aim is to counter the feelings of helplessness and isolation that chronic illness can produce. A resident artist offers coaching and advice. He can even bring a patient's artistic vision to reality if they're too weak to hold a brush. The centre also offers more formal art therapy sessions to help people to get in touch with feelings they may not be able to otherwise express. It's also about getting people in touch with their strengths as well. The supportive and positive atmosphere of the hospice comes as a welcome surprise to many who come here. Over 50,000 health professionals have passed through the various palliative care training schemes run by the hospice, and despite the vast number of books, journals and reports available, they find that the patients are still the best teachers. Now there's a growing interest in the needs of the dying in developing countries, especially with the increasing burden of AIDS-related deaths. 70% of the world's hospices are now in developing countries, and St Christopher's offers training for all. The idea is to take the latest research based on clinical experiences and adapt them to various communities around the world. The Hospice Information Service offers advice to members on all aspects of setting up and running a hospice. It also puts travelling patients in touch with hospices overseas. A recent St Christopher's patient who wanted to make a final trip to Kenya before she died was able to find out about a hospice in Nairobi. Care at the hospice is completely free of charge, while half their running costs come from the government. The rest is raised by the staff. Last year, St Christopher's won the Conrad Hilton Prize. The $1 Million award was in recognition of the pioneering work of the hospice in bringing light to the previously misunderstood or ignored world of the dying and their families. Each year, more than 220,000 people die of sudden death in the United States due to cardiac arrest. Death occurs from an abrupt loss of the heart's ability to pump. Scientists have long known that high levels of free fatty acids can trigger irregular rhythms in people with heart disease. But in a recent French report, healthy men with elevated levels of free fatty acids are also at a higher risk of sudden death. Free fatty acids are released into the bloodstream when needed for energy. In low amounts, they're not considered dangerous. One beneficial dietary fat, omega-3 fatty acids, found in fish like salmon and tuna, may actually also help lower a person's risk of sudden death. Researchers are now suggesting that routine measurement of free fatty acids may help identify individuals at high risk of sudden death. Another study just published in the New England Journal of Medicine confirms that women with no previous cardiac problems who take oral contraceptives have a slightly higher risk of heart attack. There has been debate for some time surrounding the effect of the pill on women's cardiac health. Evidence that it may cause blood clots in the heart first appeared in the 1960s. Since then, manufacturers progressively lowered the doses of estrogen. According to gynecologist Dr. Nancy Garber, the benefits still outweigh the risks, but women should still consult their doctor. This study, conducted on nearly 2,000 Dutch women, showed that those over age 24 with no history of heart problems were at a slightly higher risk of having a heart attack if they're on oral contraceptives. If they also smoke, have high cholesterol, diabetes or high blood pressure, the risk is nearly 13 times greater. 2 recently approved hormone-based birth control products for women are now on the market in the United States. The birth control patch and a vaginal ring both release estrogen, so they too may increase the risk of heart problems. And from Britain, celebrations for the opening of a $5.4 million centre designed to bring some of the country's leading heart scientists under one roof. Former heart patient Lord Michael Heseltine opened the centre, which was made possible by the British Heart Foundation's largest ever grant. Some years ago, Lord Heseltine himself suffered a major heart attack. 4 of Britain's top specialists will lead a team of more than 120 researchers. They'll be looking at the underlying processes which can cause heart disease and ways of preventing and treating it. Heart disease is one of humanity's greatest foes, and an urgent need exists to understand it and then defeat it as quickly as possible. Sentiments that 2-year-old heart patient Jack Waller would surely agree on.